There have been many proclaimed game changers in the medical fight back against coronavirus. This is the latest. The US-made drug molnupiravir was initially intended to treat the flu. It works by inserting errors into the genetic code of the virus, limiting its ability to multiply in the body. In practical terms, it's the first COVID medicine that can be taken in pill form at home to help the most vulnerable avoid severe disease, and last month the UK became the first country to approve its use.
I'm a research nurse working on a new national COVID-19 study. Calling you to see if you'd be interested in taking part in.
Researchers at the University of Oxford are testing it in more than 10,000 volunteers who've recently contracted COVID-19, like 51-year-old GLYN.
I had to take, I think, 4 in one go. Twice a day, so with a 12-hour gap over a period of 5 days, and nothing special about the medication, literally just normal capsules that you take with water, so all very straightforward. I had no side effects.
There are already questions over the effectiveness of molnupiravir after clinical trial results led the manufacturers to reduce the overall efficacy of the drug from 50% to 30%.
If you look at the studies generally, 30% is actually a very, very high level in terms of the benefits that we see on a large-scale study, and that's what we want to replicate here as well.
Molnupiravir is one of several new home treatments for COVID to be tested in what's being called the PANORAMIC study. They're likely to include the Pfizer-produced Paxlovid. It's a combination therapy based on old HIV treatments that Pfizer claims is up to 90% effective in preventing hospitalizations in high-risk patients. With 500,000 courses already on order here in the UK, the focus for now is firmly on molnupiravir.
If you catch COVID-19 early on and you treat it early on, you might then not be able to develop any severe symptoms, and this means reduction in hospital admissions and possibly taking off some of the pressure on the NHS. So quite an important study, I think.
Molnupiravir and drugs like it could prove valuable additions to a fast-growing medical arsenal. JONAH, Al Jazeera, London.